Hello and welcome to the latest edition of Compression Chronicles. My name is Oliver Jelly and I'm your host. This is a special edition AVF Jobs Grant Alumni Series. I'm delighted and privileged to have Dr. BK Lal with us. Dr. Lal is the founder and current director of the Centre for Vascular Research at the University of Maryland, a key centre for studying and treating vascular diseases like stroke as part of his extensive work as a surgeon and researcher. Dr. Lal is a clinician scientist specializing in cerebrovascular disease and venous thromboembolism with active clinical practice and leadership roles in vascular surgery and neurology at prominent institutions. His work encompasses research, clinical trials, and involvement in professional vascular societies. He contributes to clinical leadership in venous thromboembolism treatment programs. Through the AVF, he developed the country's first multicentre venous disease registry and developed a unique society-centred clinical trials centre that has successfully conducted clinical trials in venous insufficiency. He conducts randomised trials on exercise interventions for deep vein thrombosis and pulmonary embolism. He has developed patented ultrasound algorithms and applied machine learning and genomics to improve venous thromboembolism prediction. Dr. Lal has advanced understanding of cognitive mobile dysfunction in carotid stenosis and leads NIH-funded studies on carotid plaque biomechanics, stroke prevention trials, and physician credentialing in carotid stenting. Dr. Lal has held leadership roles in academic vascular societies. He has been president of the South Asian American Vascular Society, American Venous Forum, Eastern Vascular Society, and Association for VA Surgeons, contributing to their governance, research, and outreach efforts. So we're thrilled to have you. Thank you. Impressive biography. First question, Dr. Lal. What first drew you to the field of vascular surgery and how has your focus evolved over the years?
Well, I'm delighted to be here and thank you for that kind introduction. Vascular surgery in general and vascular disease in particular has been an interest and a passion since a very early age for me. Once I had decided that I was going to become a physician, one of the first things I became interested in was to build the science of medicine. And so I joined the National Institutes of Health in Bethesda in Maryland in the United States.
So from the beginning, you were interested in the knowledge base, not just the practice.
That is correct. That is correct. To me, what drives me is to build an understanding and an underpinning of whatever I am practicing or reading. And I've had an inherent desire to grow that area. And so understanding the science behind medicine and to build new knowledge in that arena is what makes it all fun for me.
So without the science, there's no significant progress.
You're absolutely right. And that's what makes it fun. And that's what actually grows a field. Because certainly we knew about venous disease, for instance, since the Greeks, since several centuries BC. However, it's the science and our increasing understanding about venous disease that has brought us to where we are today. It's not static. And so while I was at the National Institutes of Health, I began talking and learning and investigating about how endothelial cells, the small cells that line blood vessels, particularly veins, talk to each other. And it's a fascinating arena. And believe it or not, their intercellular discussions are heavily influenced by the blood that's flowing on top of them. And we call it all sorts of fancy terms like mechanotransduction. But the fact of the matter is that if there's flowing blood touching these cells, they talk one way. And if the blood's clotted on top of them, they talk a different way. And if they're inflamed, they clearly talk a different way. And so my understanding about this intercellular communication led me to my interest in venous disease. And so that's the sort of long or short journey, depending on how you define it, to venous disease.
Was there a particular moment, a particular patient that shaped your commitment to this area, um, to your life's work?
Um, yes, in fact, there was a mentor. And whenever you join any field, it's the shiny trinkets that attract your attention first. And for good or for bad, venous disease has not been a shiny trinket in any specialty. And there are a whole host of specialties that deal with patients with venous disease, and vascular surgery happens to be the most common one, but there are others too. And one of the things that my mentor, Bob Hobson, impressed upon me was that what is more important and what has a larger impact among patients is your treatment and your investigation of diseases that affect more people. So rather than being driven by what is more fascinating or attractive or dramatic, I think focusing on diseases that impact patients' lives more frequently will allow you to help more patients in the long run. And that led to my interest in two very important diseases amongst vascular disease, one of them being venous disease and the other being atherosclerosis. And those form my clinical areas of interest as well as my research interests.
Thank you. As a 2001 winner of the AVF Jobst clinical research grant, can you tell us about how your career has developed since then?
Absolutely. I will be remiss if I do not provide a little bit of a context on who Jobst was and what Jobst means to the venous physician community and therefore the venous disease community. So some of your audience may or may not be aware of this historical context, but Konrad Jobst was a German engineer by origin, and he traveled to the United States and established himself here. And in 1950, he established a company called Jobst. And he was the first one to discover that graduated compression to the legs provides physical and physiological relief to patients with venous insufficiency. He himself suffered from chronic venous insufficiency. And the way he made this discovery was while he was sitting by his pool side, and he stuck his legs in the pool and discovered that he felt better. So that led to the building of a company called Jobst. He passed away in 1957, and his wife, Caroline, actually grew that company and was the first founding sponsor of the American Venous Forum, the society that ultimately took on the responsibility of administering the American Venous Forum Jobst Award. So I do want to acknowledge that family. Of course, Jobst is now part of a larger family, Essity, but that legacy is very important to me, and I think to everyone who deals with chronic venous insufficiency, because Jobst has had a huge contribution towards it.
Thank you for sharing that. One man's journey to improve people's lives through that discovery.
Absolutely. And a continuation of that legacy support to the society led to the establishment excuse me, of the AVF Jobst Clinical Research Award. The first grant was awarded in 1995. And I happened to receive that award in 2021, investigating the role of inflammation in the development of chronic venous insufficiency and chronic venous disease. And I have to say that was my first financial support for research in this arena. That has subsequently led to over $40 million in grant awards investigating venous disease in one form, shape, or the other. There is a direct thread that I can identify between everything I'm doing today in the field of venous disease and that very first award that I received.
Because my next question was, could you discuss any legacy from the research, thanks to the grant? And I guess that's the point, that all led to where you are today.
Absolutely, absolutely. That earlier research has now subsequently over the years led to 3 or 4 very distinct lines of investigation, all of them dealing with chronic venous disease, and one of them dealing with the role of genetics in chronic venous disease. Another one led to an investigation of venous thrombosis, or DVT, in the development of chronic venous disease. And a third line of investigation is the prevalence of chronic venous disease amongst healthcare workers. And I, in fact, conducted a very large epidemiological study where I tested over 1,000 healthcare workers, just regular nurses and administrators and physicians working in a hospital. And I screened them and identified that over 70% of them have evidence of early stage chronic venous insufficiency by ultrasonography and verified by clinical features as they are walking around. And this was undiscovered. That led to a publication about 5 years ago. And as a result of that, there has become now an increasing awareness of how healthcare workers, of which there are thousands across the world, are important targets for chronic venous insufficiency. And the simple process of adding compression stockings to their lifestyle can help them. So yes, the grant has led to the original Jobst, AVF Jobst grant has led to a lot of wonderful work and certainly led to a lot of opportunities for me to contribute to venous disease research.
And it's interesting because at the beginning you were talking about your passion for research and improving knowledge, and that's a really good example of how your scientific investigational skills has led to that discovery.
Absolutely. And I do have to emphasize that without the AVF Jobst Award, I would have been just a regular clinician, and I'm not knocking that. But to me, it is far more satisfying if I can treat patients, but then also discover new ways of treating patients.
Thank you, Dr. Lal. Next question: how do you explain to patients the importance of compression therapy or pressure management in preventing disease progression?
I think that's a very important question, and I think that every clinician, regardless of their specialty, should have some basic knowledge about compression and about the value of compression, because almost a third of all adults above the age of 40 are going to have some element of venous insufficiency. All of them may not be manifesting clinical symptoms, but they will. Um, and so I emphasize this epidemiological fact to the patient. So first and foremost, I tell them how prevalent this is, and I reassure them that it is not the end of the world if someone is making that diagnosis for them. I also try to explain to them in very simple terms that because the valves are not functioning the way they should in the veins of their legs, blood is pooling in their legs. And pooling of blood leads to stretching of tissues and a whole host of other complications that, if unchecked, can lead to problems that would require much larger and more intensive interventions. And once I place all of this in context, that this is highly prevalent among adults, B, that it can lead to complications down the road, and C, why this occurs. Because if they understand that it is because of this pooling of blood, then they will also understand why it's so important to compress the legs. So for me, explaining to the patient a little bit of the pathophysiology of the disease helps me help them
And is
become
it
more
about them
compliant.
getting them to buy into the
Absolutely. Absolutely. And then we become then partners
Yeah,
in managing their problem
yeah.
rather than just me being a prescriber and writing a prescription. Then it just becomes transactional. So my primary goal is to engage my patients into a partnership in managing this problem, because this is a long-term problem. This is not something like appendicitis where I can cut out the appendix. Once it's in the bucket, the patient's never going to get appendicitis again. We can't cure this, but what we can do is improve the quality of life and improve the pathophysiology of the disease. So that's always been my approach. It takes a few extra minutes, but I think those are extra minutes spent very well.
Agreed. Patient-centered care.
Absolutely. Absolutely. Said it
Can
well.
we talk about the future? Have you got any plans that you're able to share about any ambitions you have over the next few years?
Absolutely. One of my biggest passions is personalizing healthcare. In other words, no two patients are purely identical. And therefore, it is naive to believe that those two patients' disease process is going to be identical. Even though we know that there are diseases that can be defined based on their pathophysiology and based on their clinical features and in general can be grouped together. But the fact of the matter is that there are differences. And a lot of those differences are driven by their genetic profile. And one of the things that I have done is I have participated in building a genomic bank of information on over 1 million individuals across the United States. They all happen to be veterans in the armed forces, and they've all contributed to this. And based on that information, I am exploring the propensity for different individuals to develop chronic venous disease. So that is my most recent passion and most recent line of investigation.
Fascinating. So precision healthcare.
Absolutely.
Um, do you have any advice for any young clinician scientists looking to follow in your shoes?
Absolutely. I think that what has always driven me is a desire to grow the field I'm in. Um, don't be a passive participant in your environment. Always try to leave a little influence, a little contribution behind. And to me, that has been my constant mantra in whatever I do. one of my passions is bonsai. And along with all the other um, academic titles that you listed, I also happen to be the president of our bonsai society in Maryland. Um, and I have learned a lot from various bonsai masters. I've traveled to Japan to learn from them, as well as within the United States. But at the same time, one of the things that was often mentioned to me that no one has been able to successfully create a bonsai of a banana plant. And so I've spent the last 10 years experimenting on different techniques to grow one. I've experimented with different fertilizers, different soil types, different environments, different temperatures, and it's been successful. I do have now 2 bonsai banana trees.
So your professional framework and ambitions and ethos you've transferred into your personal life with your hobby, the bonsais.
Absolutely. And it is so much fun. I can't tell you how delighted I was when that finally came to fruition.
So how small are the bananas?
Um, so this is fascinating. Um, Bonsai trees will reduce in size, of course, depending on how small you want to make them.
And for those that are unaware of the bonsai world, we're just talking about, so not just, it's very important, we were talking about mini trees, aren't we here?
That is correct. Absolutely. So they're full-grown trees. They could be 10 years, 20 years, 30 years old. But if you're talking about, for instance, an oak tree that I have, which should normally have been about 20 to 40 feet high, is only about 1.5 feet high.
Wow.
But it's about 22 years old. So similarly, banana trees can grow to 10 or 20 feet in height. The banana tree that I have is just about 1.5 feet long. But here's what's very interesting. The flowers and the fruit of bonsai do not shrink in size. So even though I have been successful in creating a bonsai banana tree, I still haven't been successful in making it flower or fruit. But I fully expect those to be normal sized if one day I'm successful.
So that's part of your plans for the future is to continue down that endeavor.
Absolutely. If I am successful, I will keep trying though.
I normally ask our guests what they do at the weekend, but I think as our final question, but I think you've more or less covered that with your bonsai exploration.
Absolutely. I spend almost all of my weekends when I'm not traveling, communing with my bonsai. I have about 60 such children, and they take up a lot of my time. That's where I enjoy spending my weekends.
So maybe a request for next time that you join us, because we'd love to have you on again, is maybe that maybe I interview you somewhere where there is a bonsai that we can see.
I would love to do that. We'll do it in my greenhouse.
Done. Thank you so much, Dr. Lal, for joining us. It's been a pleasure talking. Thank you so much.
Wonderful. Thank you for having me, and thank you for letting me share my experiences.
Thank you.